We must not allow victory over the virus to bring down our economy and destroy our prosperity. On that cheerful note, let's now go to New York, where, unlike here, things really are grim. But maybe, just maybe, there is a faint glimmer of hope too. Our next guest is one of the bravest women I know. She has just finished a grueling 48 hours in the intensive care unit of a major New York hospital. Dr Qanta Ahmed is normally a sleep disorder specialist, but she has returned to the front line to help save lives and combat the deadly coronavirus. I first met Qanta here in Australia thanks to AJAC, the Australian, Israeli and Jewish Affairs Council, and Robert McGid, who put on a terrific lunch for her at his excellent Pier 1 hotel. Qanta writes for, among others, The Spectator magazine and has worked in Saudi Arabia, Britain in the NHS and in the US. And she is well known to US TV audiences as an extremely courageous and fierce Muslim critic of radical Islam. But here and now, she is fighting a more immediate enemy, the coronavirus. Qanta, it's so great to see you again, and welcome to Outsiders.
It's absolutely great to be with you, Rowan. Thank you so much, and hello, Australia.
Well, great to have you, well, at least back here on our TV screens. Hope to see you back here in the country before too long. But Qanta, we've heard the good news this morning that infections are hopefully starting to decline in New York, but you still had over 500 deaths yesterday. You've been right there on the front line. You've just got out of your scrubs. You must be exhausted. Thanks so much for coming on. Tell us about the last 48 hours.
You know, it's been a draining few days because I lost a couple of patients that I had been working with for about 3 weeks. And we realized that there was not going to be recovery, and we made some decisions with the family and decided that they should be allowed to pass on. So we are seeing that this illness ravages people who are normally of very good constitutional health. Some patients do have the existing conditions that you've heard about, the diabetes or the cardiac disease. Many patients do not have anything of that nature. At the moment, one of my youngest patients is in the 30s. And so it's something that has been extremely striking. I've been in medicine for almost 30 years and practiced critical care medicine on 3 continents, and I've never seen anything like it. But today, as we are leaving the shift for tonight to come home, we heard that this was the very first day that we've had fewer admissions and more discharges. There are people getting better. Last week at my hospital at NYU Langone here in Long Island, I'm a few minutes away from JFK, we discharged 400 people who were healed from the COVID-19. So there are people coming into hospital, getting better, and going home. The scale of the pandemic is very difficult for people to understand if they've not seen it. You mentioned Israel. So at the moment, my hospital, which is a major hospital here in Long Island with normally around 500 beds, we have more critically ill people on respirators than the entire state of Israel. So the scale is incomprehensible, even to those of us that are normally there. I counted on Thursday, we had a dozen intensive care units. Normally we have 2 with 1 for children, 3. So we're 4 times our capacity. We've turned our library, our conference rooms into intensive care units. It's just extraordinary. But I'm so proud of my colleagues and my hospital, NYU Langone, the leadership, every employee, the hospital engineers, at the incredibly valiant and courageous effort they're making, while we all know this is a highly contagious condition.
Rita.
I want to ask you, Qanta, about the impact of obesity and on coronavirus. You wrote about how many of your critically ill patients happen to be obese. Tell us about that.
That's a very important point. And in fact, that's true not just for my critically ill patients, but for most of them that we're seeing in our institution. And data was published from NYU Langone showing that people who are obese are more often admitted into the intensive care unit. This is why I'm very fearful for the progress of the coronavirus pandemic here in the United States, because we have some of the world's highest obesity. 42% of Americans meet the definition of obesity now. 70% of us are overweight. 10%, almost 35 million people, are morbidly obese. So we can expect the coronavirus will have a very severe course. That is because obesity affects your built-in immune defenses, and it affects your ability to mount an immune defense to a new challenge, a new virus. So it is a very serious and very well described risk that we've seen in Asian flu, in the Hong Kong flu. These were in the 50s and 60s. Even in the swine flu, more recently in the 2000s, we have seen this.
James?
Doctor, thank you so much for talking to us about all this. I'm curious about what it is that makes New York different than so much of the rest of the country. I'm from New York myself, so, you know, I hate seeing all the scenes out of there. But how much of this is a factor of just the sheer density of New York, and that, you know, people are still on the subway, you breathe on and you interact with so many people in close quarters, much more than you would in a more suburbanized city? And how much of this is due to the failure or ability of authorities in New York to have prepared for this and have had enough beds and so on to be able to cope with what was coming? And just as a follow-up on that, is there just an epidemiological thing that's going to play out where the curve will naturally go up and down to some extent, irrespective of what policymakers do? If you could speak to that, I'd love to hear your insights.
Super question. Super question. I do believe it's population density. We have in the New York area the highest population density in the United States. Second is San Francisco. I believe there are about 20,000 people per square mile in the New York City area. I'm talking to you from Long Island now, Nassau County. We are part of the tri-state area. 23 million people make their home there. That may be somewhat equivalent to Australia's population. I'm not quite sure. So it's incredibly crowded. We also are within a stone's throw of 3 international airports. And so we had a tremendous ingress of international travelers in the months leading to the emergence of the pandemic. However, President Trump was very prescient in cutting down and stopping travel to and from China to the United States as early as, I think, late January. He was widely criticized for that move, but it was a very intelligent move, and it probably cut down international case importation by about 80%. So that was intelligent, and as soon as he did that, 70 other countries followed suit. So that was a good move. Similarly, with the European ban, that was also a good move. But we have not only a high population density, we also have a very high number of people with obesity. In New York City, we have about 22% obesity, but another 10 to 15% are overweight. And also, we have many families living together. The accommodations are not spacious for most people. This is a highly contagious virus which transmits asymptomatically almost 50% of the time. So it was almost impossible to contain. I do think your observation is very intelligent. This is not going to be, we're in the tsunami now, and we're holding our breath literally as critical care specialists as we see a slight reduction in the influx of critically ill people. So we've been noticing that lull in the last 48 hours. It hasn't gone down to 0, but it's much different than it was even a week ago. But we know that pandemics travel with successive waves. They don't come just in one wave. And I fully agree with Rowan's opening discussion. We cannot keep our economy immobilized forever. You have seen the United States lose 20 million jobs in less than 4 weeks. It has been earth-shattering. It has been an experience that all of us as doctors and nurses are extremely worried about, because we want our patients to have livelihoods, homes, jobs, health insurance, access, and this could all be evaporated if we remain paralyzed for this long. So that's why I think tailored quarantine is coming. And that means releasing restrictions on areas where the prevalence is low, keeping contained. New York will still be under restrictions until May 15th, according to the governor, until we start to see some diminution, and then resuming activity in the economic sphere with those restrictions. About supplies, let me tell you, there has been an inhuman and incredible effort by the governor of New York, who's a Democrat, and the president of the United States, a Republican, in getting us mechanical ventilators. So now more than half of our patients in the intensive care unit are on some form of mechanical ventilator that we have either re-engineered and repurposed for critical illness or is from the federal and state-based stockpiles. Today, I looked after critically ill patients with the help of travel nurses out of state from Florida. So the collective effort to support us in New York is just so humbling. And the fact that even a hospital of my stature, NYU Langone, is tremendously powerful and effective healthcare system. We have 45,000 employees. We have multi-billion-dollar operating budget. And yet we also needed this help, and we were able to secure this help with all of the PPE. That is a function of tremendous governance. And despite intense polarization in our politics, really successful government supporting Americans and everyone who lives in America, whether they are citizens or travelers or whoever they are. Some of our patients, we don't know even who they are. They have no identity. They may collapse and we take care of them. We don't know if they are here documented or not. Everybody has had a high grade of critical care. Nobody has been denied critical care because of a lack of a device or a resource. And no doctor that I've seen since I've been doing this for almost a month has had lack of protection or lack of supplies. That is an extraordinary feat.
Qanta, just very briefly before we go, just specific treatments. You mentioned ventilators. There's been discussion about how effective ventilators are. You're a sleep apnea specialist. Obviously, oxygen masks play a key part in your other role. Also, you've mentioned drugs like Plaquenil, hydroxychloroquine. Where are you sitting on these various alternative treatments or treatments?
So I think it's going to emerge that Plaquenil has a very pivotal role. And while most of the world first heard about Plaquenil when President Trump was speaking about it, in medicine, we know it as a tried and tested drug for malaria for 70 years, for various arthritises for more recent times, and it clearly has some other properties. My suspicion, and many researchers are writing this, is that the virus is acting at the level of the red blood cell, preventing hemoglobin from absorbing oxygen and carrying it to where it needs to go. Plaquenil seems to be able to interfere with that disruption the virus causes. Plaquenil also has a way to modulate the immune system. Similarly, the azithromycin. So all my critically ill patients have that or have received that. We're also seeing success with special immune modulation drugs, which cut down on the cytokines. The reason obese people are more at risk is they have a lot of different levels of escalating cytokines that produce a disturbed immune response. We are using on our patients drugs to inhibit, switch off specific areas of the immune response, and that has helped them. We're using high-dose steroids. We have used in some of our patients extracorporeal membrane oxygenation. That's like an artificial heart-lung machine, but we use the lung part. And today at NYU Langone, our first patient that was put on the artificial lung machine, the ECMO machine, actually went home and got better. So the kind of critical care medicine that we're doing, we're using our imagination, we're reading data every day, and we are changing our practice every few days based on new data, and we are seeing that success. One thing I am concerned about, if I can tell all of you, is that these patients are going to, some of them need long-term care in terms of respiratory conditions. They may be left with long-term dysfunction of their lungs. Some of them may be needing oxygen for many weeks to months, perhaps even longer. And then the psychological impact. Can I tell you that these patients cannot be accompanied by visitors? They are surrounded by doctors and nurses. We're heavily gowned, masked, face shields, goggles. It's very isolating to be sick normally, and now in this environment, even more difficult. We've had to have some of the most heartbreaking conversations with families on the telephone who've truly supported us with their confidence and their faith and their guidance as we try and make some of the final decisions in the lives of other human beings. And this is going to take an enormous psychological toll on families that have lost someone, on patients who have survived it, and on the medical workforce. And all of that is yet to be accounted for.
Dr. Qanta Ahmed, thank you so much for coming on Outsiders. The patients of New York are very, very lucky to be in your hands. Pleasure. I can say that. Thanks so much.
Thank you.
And we'll chat again. Keep up the great work. You deserve a good night's sleep now. Thanks so much, Qanta Ahmed.
Thank you. Thank you.
Coming up, James on those Americans who have had enough, plus Craig Kelly on some of the reasons why the coronavirus has killed off climate alarmism. Can't wait. You're on Outsiders. Back in a tick.